Hello, Regent Park. Welcome to today's show. Today on TV, we have a very special individual, Adbulkarim. Nice to meet you, Abdul.
Hey Nixon, nice to meet you too.
And Abdul is he got into medical school, which is a great achievement. He successfully passed the MCAT, which is a prerequisite to get into medical school. And you completed medical physics as undergrad, right?
Yeah, that's correct.
That's good. And today he's come to talk to us about a very special initiative he's taking in his community. And I'll pass it off to you, Abdul.
Sure.
Can you tell us more about it?
Absolutely. Well, thanks for the introduction, Nixon. So the project I'm working on is in the community of Regent Park. So I grew up here for about 15 years, and I lived through many different experiences, which sort of shaped who I am today. And now being in medical school, I was really interested in engaging within the community and sort of finding out if people in the community are getting the type of healthcare that they deserve. And so I wanted to kind of explore the experiences that they're facing. And so that's sort of the premise of the project that I'm working on.
So I understand it's a survey-based project. Can you explain the process of how you collect this data?
Absolutely. So we're essentially just doing face-to-face interviews with people in the community, and we want to hear about their concerns, challenges, any issues that they face when they're seeing their family doctor, and so we just want to engage with them and get their opinions and thoughts on that.
Wow, that's amazing. And what prompted you to take this initiative?
Well, it's a really good question. I grew up in the community for most of my life, and I interacted with the doctor. I saw my parents kind of experience the system, and I always saw that they face certain challenges. My dad can't really speak English so well, and so there's that cultural boundary interacting with his family doctor. Even in terms of meals and food and things like that, the diet recommendations that were given to him by his doctor were not always in line with sort of the cultural cuisine that he is used to. He's used to Sri Lankan sort of food. And so when I experienced and saw those challenges, I felt like, I'm sure because Regent Park has such a large immigrant population, I'm sure this is something that a lot of other people face as well. And so I figured, why not kind of explore that issue and see if we can bring more exposure to the issues faced by people in the community.
Very nice. So tell me, what do you hope to accomplish? What do you see as the end point of this project?
Yeah, well, that's a great question. So we basically want to create more awareness about, again, issues that people in the community are facing. And I guess in the long run, ultimately, we'd hope that we can implement some sort of positive change to the system so that it's more conducive and it's more it's fitting and appropriate for people living in this community. So if we can improve access to care in even a little small way, I think it'd be we'd accomplished our goal. Yeah.
And I heard that you have 2 volunteers that you've recently hired, working with you on this project. Do you hope to hire more individuals to help out, more helping hands?
Yeah, good question. So we have interviewed 2 people already, and we're definitely hoping to interview more people along the way. And really, anybody's welcome to be interviewed, as long as you've kind of experienced the healthcare system in some capacity or some way, and you have some thoughts about your experiences. It could be positive, but it also could be negative. We're open to hearing about really anything that any thoughts that you have.
So how do people get involved in your interview process?
Great question. So to be involved in this project, you can essentially contact me, not sure, I guess I can leave my email address, or I'm not sure if I can announce that here or not, but
okay.
Basically, if you get in touch with Focus or RPTV, I'll leave my contact information with the people here, and they can get in touch with me.
Okay. Thank you very much, Regent TV, and a special thank you to Abdul.
Yeah, thanks so much, Nixon.
We hope to see you soon. Take care.